healthcare insurance companies act as the provider, act as the pharmacy, and act as the insurance company. They need to figure out how can they make money on every angle. I've been doing this for almost 24 years now. So I started doing this at 17 years old. This is the third network that I built. Only about 10% of most insured people in the country reach their deductible. Most people delay care. They will finally reach that deductible, but then there's ways that, of course, the insurance carrier is going to deny a certain service. They didn't look at the diagnosis that was easily discovered, put him on morphine, and he eventually died 2 days later. That death was preventable.
Welcome to another episode of Inspiring Business Leaders. Today, I'm with Jared Pierce, who is addressing one of the biggest challenges in America, the healthcare insurance crisis. Jared, welcome to the show.
Thanks for having me.
Well, like I said in the intro here, we're having a healthcare insurance crisis in America. We've been seeing it all over the news. People are seeing it coming out of their pocketbooks. What in the heck is going on?
Well, there's a lot of solutions being offered to employers that really don't bring as much value as they think they are. They're investing sometimes too much into things that might be applied in a scare tactic mode. So even down to a pharmacy benefit, mental health, different care navigation systems, or even some of the legacy networks that I unfortunately get compared to or compete against that aren't bringing as significant savings to the actual employer. They might be great on covering the employer or member's needs from a specialty stance, but they're not bringing on actual savings that can be used back into the plan or given back to the employer.
And so your company, Unity Preferred, is changing the game on this right now.
We are. So we are contracting all across the country. We're covering all specialties. There is no network that is growing at the pace that we are. So we really listen to our members' needs and we customize the network so that we're covering all specialties, all regions, because we do work with some plans that are in 30, 40, almost all 50 states. So if we can tackle where we're expanding the network, but also contracting at fair, honest reimbursements that still keep the provider profitable, then we're, again, accommodating all parties that are involved in this equation.
So what is the problem that you saw? And then how did you develop this company to work with the providers and the insurance companies to bridge whatever gap you're bridging right now?
So I've been doing this for almost 24 years now. So I started doing this at 17 years old. This is the third network that I built.
Wow.
So I understand kind of the do's and don'ts of what I had success in the previous networks. And what I saw was I took a couple years out of the network game, but I still stayed in the healthcare industry. So I was a partner of a medical billing company where I was doing the negotiations and the contracts for the providers. These were for surgery centers, drug treatment centers, and some other subspecialties. And what I was seeing was that there was this new emergence of different solutions that weren't even applying a real contract, a discount. So they were just trying to beat down the provider as much as possible. On the other hand, I was also still selling to the TPAs because I was selling a cost containment solution around surgery education. So I was kind of wearing multiple hats, still very involved with selling to the health plans. And I got to kind of play a little dumb and ask questions like I wasn't about to go start another competing business. So I was realizing, because these TPAs were calling me up and saying, "Hey, can you build me a network? And I know this is what you do." I was like, "Oh no, I'm great where I'm at. I'm just sitting back, and tell me about what you're using though. Tell me about what they're failing at." So I got to really listen in on what they were struggling with, what the issues were, and also seeing that some people were being really naive and thinking that, "No, we're covered. This is it. This is working great." And I said, "No, it's not," in my own head. So it was kind of that moment where I was like, I think it's time to start another network. And so I took all that knowledge. I was able to, again, still have a really good Rolodex of people on the provider side and on the payer side. And I just tackled these issues, head on, where a lot of people were, "You're crazy. Why are you building another network? Why are you trying to do it the right way?" And I said, "What do you mean?" So it was kind of funny. And again, nothing against my competition. A lot of them are very successful, and a lot of them now have big pockets because private equity has come in and invested heavily in this industry. But I was able to, I think, really tackle the issues head on and kind of forecast where the industry was going.
Wow. What do you see is the biggest issue with American health insurance that most people that are covered don't understand about the issue with health insurance in America?
Well, The issue with healthcare and healthcare insurance in America is that now, unfortunately, you've had the healthcare insurance companies act as the provider, act as the pharmacy, and act as the insurance company, which is never good for the consumer or the provider. So you're having so much consolidation in one company that they need to figure out how can they make money on every angle. And it's never, again, for the better of the consumer. And these insurance carriers have notoriously kept a closed network. So they're not actively growing and getting more providers, getting more hospitals, getting more surgery centers. They're saying, this is who you go to. We don't care about quality as much, but these people give us the biggest discount. And so if you go to them, great. If you don't, hey, it's going to be another deductible that you can't reach ever. So only about 10% of most insured people in the country reach their deductible.
So, okay, I have a PPO that says $7,200 a year deductible.
Mm-hmm.
I go in for something that costs $3,000 and say, out of pocket. That's not covered in my insurance.
Yeah,
So they're billing me for my monthly allotment
of course.
and the $3,000.
Yep.
And they say, until you reach $7,200, you're going to have to pay out of pocket.
Of course. Good luck. So now most people delay care. They will finally reach that deductible. But then there's ways that, of course, the insurance carrier is going to deny a certain service or have you, and of course, the provider at times can even delay, hey, we can't see you for another 3 months, and you're like, please, I'm this close to hitting my deductible. Please see me. But, doctors are overworked. And at times now, because of some of the methodologies and the new discount companies that we compete against, they're making it very hard for a provider to feel like they're even going to get paid. So there's now even issues with getting access. So there's a lot of companies that, again, you present your card and you're like, you're in my directory, and like, no, we're not anymore. We opted out of that, or we don't want to take this card because we don't know what we're even going to get paid. So there's a lot of scare from the provider side that why am I going to deliver all this care, treat a member, and then eventually it's going to be denied, or I'm now becoming a collection agency and just balance billing you all day.
Wow. So what's your thesis to solve the healthcare insurance crisis right now through Unity Preferred?
So what we're doing is we're contracting with really innovative brokers and health plans that do not want to rely on what's called the term BUCA networks. That's Blue Cross, United, Cigna, Aetna networks. And in doing so, we're able to take an actual role as that primary network where we can provide the directory. Members can know where to access care, ranging from every specialty they need in their area or on a national level. And then what also is happening is the brokers are creating incentives for the members so that they're not paying into their deductible or their co-insurance level is being covered by the plan. So we're contracting with providers at very favorable discounted rates that still keep the provider profitable. And in doing so, the member now knows, wow, if I go to this provider, I don't even pay a deductible. I don't pay a co-insurance. I'm being now incentivized to utilize my benefits if it is the appropriate provider that Unity is contracting with.
Wow. So the patient gets better care. The doctors and the clinics and the hospitals get the proper reimbursement?
They do. So in this scenario, we're contracting at a Medicare level, even though our members are 20 years old, 30 years old, 40, 50, whatever the age may be. But what's happening is that we're using that baseline. And in doing this for 20 plus years, in the early 2000s, we were never applying a Medicare methodology. We were only doing a discount off whatever the doctor billed. Now, doctors back then were billing a little bit more fairly. And I'm not here to say it's one side or the other, but yes, providers have increased their bills over the years. And that's, again, with a lot of different factors that come into play. But we cannot apply a contract that was established in 2010 that says it's a 30% discount off of bill charges, because who knows how high that charge master has increased. So the same procedure that was $500 might be $2,000 now. What does that 30% discount really bring? And so that's why we have now contracted at a Medicare level so that it caps off, regardless of however much the provider bills, we are guaranteeing that they are only paid at that allowed amount. So they can bill $10,000. Great. You are still at 120% of Medicare that grants you $800. So that $9,200 discount is where we show the value and the savings to that actual health plan.
Now, who gets the long end of the stick here and the short end of the stick of all these deals you're making?
Well, that's where we have, and this is kind of when I was on the sideline, you could say, and also on the billing company, was that you had older networks that were on that model I mentioned with a 30 or 40% discount off bill charges. Then you had what's called reference-based pricing emerge over the last 10, 15 years, where they're using technology and historical claims data and applying an algorithm that the provider never consented to. So they're seeing a bill and they're saying, we don't care, regardless, we're giving you $150 in Medicare. And the provider's like, what? Like, I didn't agree to this. Like, what do you mean? And so you had that middle ground of older networks with discounts that weren't favorable anymore because it was a discount off bill. And then you had the RBPs, which, again, some of them are my friends, so I'm not here to bash them, but come in and just completely bully the market and just say, hey, I don't care if you're board certified. I don't care if you're in a rural area. I don't care what you are. You're taking this rate. And if you don't, whatever, go ahead and bill the member. And so they've been charging a ridiculous premium to the health plans and to the brokers and whoever it is at their businesses, pocketing that revenue, applying an algorithm, and not really caring about the member experience, the balance billing, the noise, or the provider now acting like they're a collection agency. So that's why I felt it was perfect timing, because RBP, as much as it's been successful, there needed to be another solution that actually can bring legitimate, signed off, secure discounts at a Medicare level where a provider's consented to that rate. Because we don't want our members being balance billed. We don't want any noise. We don't want any appeals. We have no issues at all when it comes to appeals because it's our paper. The provider signed off on this. And because we've only been in business for less than 3 years, this isn't some 2010 contract. They're like, well, who the hell signed this?
Where does the transparency come in for the patient, the provider, and the insurance company through you? Is that all transparent up front before they get services rendered?
It is, because we know the threshold we have to be at for a Medicare level. So yes, there is some providers, let's say if you're in a rural area or if you're board certified or whatever the situation may be, or if you're the only provider in this one area, we might have to be at a higher reimbursement rate on Medicare. But because we contract within those parameters and we don't really go outside of those parameters, the provider's still staying profitable, getting more than what they would from probably a United or Cigna or Aetna plan. The member's seeing significant savings because it's not one of our older competitors that just has a 10% off whatever the hell is billed. And then also the plan is seeing, because now they can create those incentives where they know we're seeing real valuable savings, and these are high quality providers. So we only get paid from the health plans, but we have to have happy, profitable medical providers, or we're not going to have a network that's going to be sustainable, or these people are going to be eventually gobbled up by large insurance carriers that now just control the whole market.
Do these healthcare providers like you guys, or do they not like you?
They do like us.
They like you.
Well,
oh, wow.
Well, remember, because we're not doing reference-based pricing where we're just coming in and saying, this is what you get, take it or leave it. We don't even need a contract. We're going out of our way, initiating the conversation, explaining the difference of what we do, identifying the members we can steer their way, and then from there, providing a fair and honest reimbursement rate that keeps them still profitable. So the difference, I guess, where, again, I've been doing this forever, I could easily, without getting a contract, say, they'll probably accept this, they'll probably accept that. But we're doing the work to secure this contract so that it lasts forever. And that, in a good way, some of our competitors have pissed off the industry too much that now they're realizing, oh, gosh, we probably need to do this now the right way. We probably need to go get real contracts. And I'm like, well, good luck. You've already basically pissed off everybody. I mean, and that's where we educate providers. Look, we're here to save you from reference-based pricing.
Yeah.
And again, there's some good RBP vendors, there's some bad ones, but ultimately now they're all trying to change or promote, hey, we're not just RBP, we're doing real contracts. Really, they're probably calling us and saying, can we lease your network?
Wow. Amazing work you're doing, Jared. Wow, that sounds it's all very complicated, but it all
It
sounds
is.
like it's good stuff for everybody involved in this process.
It is. And we don't get the pat on the back I think that we should, and that's fine. We know the work we're doing. The providers understand when we're involved. And now if it is one of those plans where the member is truly incentivized to use it, they are very thankful that Unity's on their ID card now.
Amazing. Let me take a step back to Obamacare and the recent things in legislation for a moment. How does policy like Obamacare and Trump's recent there were some recent things done in the big beautiful bill with healthcare. Were you in when Obamacare came in, and did you see a difference in how healthcare coverage affected providers and patients alike? And then, so we were talking what 2008-ish, and now recently we've had some changes. Talk to me a little bit about the political policies going on in healthcare and what people should know about that.
Yeah, I mean, I think there was a lot of good intent with Obamacare. I think it caused more confusion. The intent was to lower cost of healthcare, and unfortunately, it did the complete opposite. I think that's what has increased rate increases from every single angle, either being the provider increasing their rates, the health plan increasing their rates, the insurance carriers, whatever the broker's fees, the solutions of another solution, because there's so many different, you know, products and solutions that pop up over years. And I'm like, how did this become a solution? Like we're already covering 80% of this problem, and now you're just basically banking on the 20% that could probably be modified in this other solution. So I think that it's created a lot of scare. The one good thing I think that it, of course, did do was eliminate pre-existing conditions. And that was a very cruel and unnecessary thing that they were able to bank on from somebody that, again, it wasn't just a lifestyle choice of maybe why they became, with a pre-existing condition. This could have been genetics. This could have just been something that they could have never, avoided. And so that was, I think, a great product because there was discount health cards that acted like insurance, and it brought no value. And yet people were walking in there with their discount card thinking like, hey, I got insurance. We're like, no, you don't, well, we'll give you some meds, that's about it. And so I think that the intent of it was good. There was too much stuff that I think was thrown in there that really later down the line, a lot of people knew were going to be problems. And now that's what we're dealing with. As for what Trump's doing, I think it's great when it comes to the pharma side, because I've been saying this kind of like how I was in my, Nostradamus phase of where I felt we should start another network, is the PBM world, pharmacy benefit manager world, is a mess. And it's been a mess. And I'm happy that Mark Cuban and other really smart people and successful people are trying to tackle that. Not gain some more friends in the pharmacy benefit manager world, but I really could care less, is those people are the reason why costs are so high on pharma. And I'm so happy that, again, like Trump, don't like Trump, put politics aside, he is driving down the cost of pharmaceuticals.
Are we seeing that yet? I know that he's going to providers in other countries that either source our drugs or buy our drugs and saying, hey, if it's lower here, if it's $1 here and it's $10 to us, it needs to be 99 cents to us or $1. It needs to match the lowest cost of this drug that you're selling across the planet.
I think those savings have not been truly seen or identified quite yet. I think that is coming. But what it has done, it has put heat and pressure on the companies I mentioned that have been abusing the system and jacking up prices. So I think now those folks are seeing, okay, we probably should get our act together. We should probably do this a little bit better. And we should find ways that we can still be profitable without completely jacking up the price of this PBM management system or being able to lower these drugs, because again, it's pretty outrageous. And especially, we have the luxury of living here in San Diego where, we could go down to Tijuana and get some meds for much cheaper, or people on the northern part of the country that can possibly go to Canada. But if you're living in St. Louis or Oklahoma or, middle of the country, you don't have that luxury, and of course, a lot of people don't really know how to educate themselves on where they should be getting their meds from. And it falls still on the broker, falls still on the health plan. And, again, when you have PBMs, though, that are giving a nice premium back to the plan, not the employer, but to the plan manager, why am I going to try and change when this is a great revenue stream back to me as well?
Yeah, and I mean, I like you said, like Trump, like him or hate him. I mean, to do this, he's probably pissing off some of these pharma companies.
Yes.
It doesn't do him any good to lower the prices, lower their profits. I would think it's a win for him, for the American people, and all parties involved in this.
It is. And unfortunately, as we know, regardless if it's red politicians, blue politicians, they all are smart business people and they all are profiting from the healthcare industry. So it's good to see that it's probably disrupting both sides. And and that's where I think, again, it's easy to criticize him, but there's a lot of good that he's doing. And I think that the healthcare industry needs this. Now, if it's fully implemented, we'll see. But I think the intent is there.
Continue on that topic. Trump has talked about reforming the healthcare system. I know in his first term he tried to reform it, and he couldn't figure out a solution. He's talking about some new solutions now.
Mhm.
Do you think in his term we will see a new structure to our healthcare system?
I hope so. I think that the biggest thing that we would need is removing some of these merged companies like United, who owns now the pharmacy. They own the provider. They own the clearinghouse and the payment claim system as well. And when I won't say into specifics, because again, some of these people, are potential or existing clients, but when you have such consolidation, you remove the real true intent of what the insurance carrier's job is to do. And so that's where I see Elizabeth Warren and I see, Mark Cuban trying to put together bills that would remove those assets from these insurance carriers. And I would think if anything can be done, that would be the biggest accomplishment. I know there's a lot of other things that we're trying to do and in the pharmacy space, but I think that would be the greatest thing for the American people if that was removed and you put insurance carriers back to being actual insurance carriers,
Yeah.
not the medical provider, not the pharmacy.
I mean, it's a monopoly.
It is.
truly what the founding fathers were like. Hey, no monopolies, because it drives cost up. It silos people into whatever path they want to take them in their organization.
Yeah.
They can just charge whatever they want to charge, and
It's ridiculous. No, it's ridiculous.
Let me switch gears here. Let's talk a minute about wellness versus healthcare. And I don't know how much you know about this, but in insurance plans and when you're seeing providers, is wellness being talked about as a means to help prevent diseases when there's wellness tactics that are proven to prevent some of these diseases before you have to go in and get surgery or you have this terminal illness now? Like, what does the wellness landscape look like versus fixing the problem when it's already, in the person?
Yeah, I mean, I think that wellness solutions and wellness providers are emerging. We have put a strong emphasis on wellness and mental health. There is so many things that can be prevented that lead to a larger medical bill or a catastrophic claim that could be prevented in simple wellness or mental health treatment. And I think when you're not truly incentivized by big claims and negotiating those down and getting paid large amounts to try and hopefully have an overpriced bill that you're then bringing that price down, it removes that incentive. And so we put a big emphasis on direct primary care. We put a big emphasis on collaborative care. What we're trying to do is keep the member central to certain providers so that they're not bouncing around town and getting all these different bills and outside of an ecosystem that can be controlled in one cost. So what we try to do is educate the members on certain care that is much cheaper, but now is preventing a much larger issue for the member.
Wow.
And again, it's sometimes some people, you got older folks that no matter what, I got to go to my hospital. I want to go to my hospital. And it's like, you don't. You're going to get you're going to get maybe more sick going to this hospital. I'm sorry. And taking some of these procedures or treatments out in a much more controlled direct primary care model. But unfortunately, some of these networks, because they can't make a lot of money on that, why am I going to push actual real care?
Yeah, wow. That is something. I'm looking at healthcare insurance in America like we're all in a pool together, similar to the car insurance companies. When there's a ton of claims, when the fires happen, the natural disasters happen, we see our insurance for our car go up. Is it similar in the healthcare industry?
Yes, but to be honest with you, I don't know how prices are keep rising, and that's where it becomes greed. And that's where it becomes, let's just apply a certain methodology. Let's also, now that I am in the insurance carrier and I'm the medical provider and I'm the pharmacy, well, I'm going to tell these two entities to start overcharging. So then it can justify my rate premium increases because they're supposed to spend a certain amount of their profit back into the plan or give back to the stakeholders. Now, if I'm the reason that prices are going up, well, I'm justifying why I've just increased your rate premium. And so that's where if you eliminate those types of scenarios where you're getting insurance from your medical provider and your pharmacy, well, what is their incentive to lower costs? It's none.
So you mentioned one of the things, like let's say you were Trump and you wanted to re-gut the healthcare system and the insurance system. You mentioned monopolies being one of them, United being an example. What else would you do? Like if you had a chance to kind of remap this out with the knowledge you have, are there other suggestions you would have to help fix this crisis?
So outside of removing and stripping them from the assets of being a medical provider and a pharmacy and an insurance carrier, I would say that there is a lot of smart, innovative brokers and health plans, one that luckily we work with, that are customizing the plan specific to the member's needs. So it's not just here's your 1, 2, 3 options. Having multiple different options based on the certain member's age group. Because a guy that's 29 and somebody that's 63 years old, they have different health needs. Why am I signing up for basically the same health plan?
Right.
And so customizing those plans and also removing the notion that you need Blue Cross on your card or United on your card or Cigna or First Health or whoever it is that's a national well-known brand. Having it be that you're having direct contracts that are customized to the plan where there is real steerage, that's where you could convince the provider to actually be willing to take on more members and not deny people at the door. So there's a lot of companies out there that are changing their name because they're running into access issues, because they've continued to bully or deny claims or, be able to really lean one side or the other. And it's never usually in the benefit of the medical provider. So I understand why providers are saying, like, I'm not going to take you in. Like, I mean, I like you as a person. I'm sorry, but I don't think your insurance carrier is going to pay me. And I don't want to make sure that I'm then balance billing you this $2,000 bill, because what's going to happen? They deny their care and they get a bill. Do you think that member is going to be like, oh, my poor provider, I wish they got paid? No, they're going to be like, this shady, overpriced, corrupt hospital is just trying to bill me, and it's like, no, they're trying to stay profitable, because the only one that's staying profitable is this insurance carrier that keeps collecting your money, supposedly providing a network that you can access that now doesn't even get you in the door.
Wow. Well, let's talk about employer-sponsored healthcare versus individual. I'm on an individual plan. I'm self-employed. And then you have those that work for Qualcomm or whoever, big companies, and they have employer-sponsored healthcare programs. Do you take more or only employer-based programs, or do you also take individuals in your network?
Good question. So a lot of our competitors are really only chasing those huge employer groups, of course, because it's going to be more revenue to them in the door. We have brokers that are signing up with us that are placing the business in different TPAs or health plans that are as small as 5 employees. So we will typically sell directly to that small of an employer group, because we like to go through the broker and the TPA or health plan, but we don't limit any employer sizes. We just signed up a group in West Texas, 23 employees. A lot of our other networks would probably like, no, like, we're not taking that on. Why are we doing that? And the way I see it is like, wow, 23 employees. Okay. Yeah. It's not going to be our best money maker, but really we can put a little attention on them, already provide the network we have, and now they're covered, and maybe they're a client forever. And as they grow, great. They're going to probably be able to increase more employees, because now we're saving them on their biggest spend, which is healthcare.
That range of employer is the biggest range. Like small business is the biggest segment of businesses in America.
Exactly.
So it's good that it's a good market for you, maybe.
Yeah, it adds up. And that's where it's funny, because I was just at a conference and They're like, oh, we only sell to like 5,000, employer groups. And I'm like, so you only sell to like 5% of the employers in the country? I'm like, well, okay, well, good luck with that number, And so that's where, again, we have the luxury, and none of our competitors really have this, is that we're privately owned. So we didn't bring in private equity to come fund this. We don't have a bunch of investors. There's 3 owners. All 3 individuals of us really care about the consumer. We've been in the healthcare industry a while. We understand that, again, we're trying to change something for everybody. And we're not just doing this to flip the company quickly and move on with life and then start another venture. I've already been doing this for a good amount of time. I'm still young, but I don't want to go build another network. I want this to be the last one, and I want this to be the model of how it should be, hopefully moving forward.
Great. So let's talk about you a little bit. Where did your passion, where did it come from for this, and what kind of passion do you bring into it now to genuinely help everybody involved in your eco-cycle?
Yeah. So I started doing this at 17 years old. I guess I'm living my high school dream. But I was always knew I was going to be in sales in some capacity. And growing up here in San Diego, we only have a few options. And unfortunately, one of those is an HMO product. And I won't say the company's name, but it's an HMO product that usually is not really delivering high quality care or real much value, especially if you go outside of the network. So I had a family member who was 16 years old, had some issues with the stomach, went in, misdiagnosed, went back home, issue occurred, was rushed to the hospital, luckily went to another provider here, and not an HMO product, diagnosed very quickly, was ready to do the procedure, but the HMO product immediately said, we want our patient, give us our patient. And could have easily done the procedure there. If we could have gone back in time, we probably would have just said, no, we're going to pay the out-of-pocket expense, we'll deal with this. But was rushed over to the HMO hospital. And unfortunately, was just sat there, no treatment. They didn't look at the diagnosis that was easily discovered and put him on morphine, and he eventually died 2 days later. So seeing that issue and feeling that as a family member, also I was very early in my career during that time, really made me want to bring a PPO product on a national scale and give members options. So, that death was preventable, but that is one of many situations that I know exists all across the country, not just in that one HMO product. So, that was kind of what's, again, I think been a lot of passion and the driving force to really change healthcare and give people options. We pay so much for healthcare. You should have options. You shouldn't be told where to go.
And how do you stay healthy? Do you follow? What's your personal development? Do you work out? Do you eat well? Do you get good rest?
I could probably work out more than I should. I mean, I've been traveling. I've been in 10 states already this year, probably. So, I try to be active. I try to stay positive. I still actively play volleyball. The vertical is not as high as it used to be, but I golf, even though you're probably not burning many calories on the golf course. But yeah, I do work out, and I do eat well. The one thing I guess you could say is a lot of people, they can feel drained about what they do, and I'm working so many hours, and I guess maybe I'm just a little crazy, but I love what I do. So I don't consider it work sometimes.
You're a father.
I am.
And you're a volleyballist, and you're a CEO.
Yes.
So how do you manage your time effectively between all these roles?
I probably could sleep more. But I would say that I'm probably never stop working. Luckily my son, we have a great relationship. He's active. He's very good at entertaining himself. And funny enough, he's already trying to get into the family business. He's 11 years old. He wants to start calling doctors, and he wants to start negotiating claims. And, I love it. And, but at the same time, we do make time. We do, spend quality time together. I love to travel. So I'm not just for work, but actual, get away from the country travel. So it's, we do positive things together, and he's, again, 11, probably going on 20 sometimes. So,
Wow.
we can have conversations that you typically wouldn't have with an 11-year-old kid, but I'm probably gonna have to cave in soon and maybe giving them internships then, I guess. Then we can spend even more time together, building the empire.
Awesome. What do you think makes a good parent these days? What do you think is, I guess let me rephrase the question. What do you think is making for poor parents?
Hmm.
And what do you think is making for great parents these days?
I think we have, unfortunately, a lot of parents that, will play the poor me card on how their life was. And I think that parents are not holding their children accountable as much as they should be. My dad's in his late, mid 70s, was raised very old school, and I think that we don't hold our kids accountable. And, we want to be their best friends. And it's like, no, we need to discipline them. And my dad, there was a lot of times, and I was predominantly just raised by my dad. And so having him play multiple roles and be a single dad, I was able to see those struggles later in life as a father myself too. And it really took me probably till I was about 20, 22, 23 years old, where I was like, man, thank you for doing that. Thank you for holding me accountable. Thank you for disciplining me. Thank you for making sure I stayed on top of everything I needed to do. And I think that's what parents lack now. And, here's your iPad,
Yeah,
I mean,
yeah.
which who knows what the hell they're watching there? You could put it still on YouTube Kids. I watched them like, what the hell is this? How is this on the kids section? So I think just parents being more involved, not just with the paycheck and saying, hey, go do your activity, but really, having those conversations and talking to your kids and explaining this. And you know what, again, they're going to understand when they get older in life. They may not like you that much. They may not think you're cool or whatever it is. Who cares? Have those awkward conversations and put them in that disciplined situation. I'm not saying go beat your kids, but, hold them accountable for what they're doing. And from there, they're going to thank you later in life, and they're going to be a more productive human in society.
Yeah. I mean, you see, I always compare this to animals in nature. I mean, we are part animal. I think, I feel like at some point we also have a higher consciousness that can make discernment. But a lion in the wilderness is going to kick its cub's ass if it messes up and swat her real hard and say, "Wait, no, you almost ran off the cliff."
Yeah,
Right.
yeah.
I mean, you prevented him dying.
Exactly.
You had to whip his butt a little bit.
You do.
Yeah, I mean, if we become too soft, I think it's amounted to a bunch of bad behavior.
It does a disservice to the kid. They then take that behavior, they teach it to their other kids at school, and it becomes a pattern, And again, I know a lot of good parents, but yeah, there's definitely a lot of bad parents I know out there.
So your kid's a Gen Alpha? Gen
Yeah,
Alpha?
yeah.
Gen Alpha? Yeah. What are you seeing with your kid and his colleagues and I'm sure your kid has friends and you see their parents and you see the other kids.
Yeah.
What are some trending things you see going on with kids that might be good or bad that you're just seeing a lot of right now?
So I think there is some good where kids are understanding, certain business or access to information and trying to become young entrepreneurs, which I think is great. I think this definitely is different across the country because I have clients across the country, and Midwest kids are gonna, they're already shoveling snow, they're already working hard. California kids, I'm a California kid myself. We got it easy out here sometimes. There's
Surfing,
skateboarding. Yeah, exactly. So
going.
so what I have seen is I think there is a lot of kids that again are trying to understand business, or there's access to things that they can kind of learn on a business side. But I think the bad stuff is, again, they're all trying to grow up too soon, and my son, he's the youngest in his class. He's an August birthday, so he could have been on that cusp, but we could have maybe held him back a year. But the good thing about it is, with him, like, a lot of his friends have cell phones, and we gave him a phone and he never used it. And so we were like, all right, well, we're going to take this thing away. And he was like, there you go, which I was like, wow, like, thank God my son is this way. And that's going to change. I know eventually he's going to want that phone back, but him still having his imagination and being a kid and playing with Legos and, creating storylines. He loves to write scripts and create his own storylines. So it's encouraging your kid to still be a kid. Like, you're going to grow up and then it's done, and so I really try to press, and he's like, oh, Dad, I don't know. I'm not as cool as these kids. I said, son, let me tell you, there's no one cool at your school. Like, there's nobody cool at your school. You guys aren't cool yet. You guys don't have jobs. You guys don't have nothing. You guys don't do nothing. Like, I'm sorry to burst your bubble, but nobody's cool at your school.
Yeah,
I'll let you guys know when you maybe get to that level.
Gosh, that's awesome. Are you concerned? I know AI is a big topic. I
Mm.
I, I don't really want to go too deep into it, but just in the AI journey on your company or for your kids, what are you excited about or again nervous about with
Mm.
AI implementation across everything in our lives right now?
Yeah, I think there's a lot of positive things that AI could bring if we're talking specific to my industry, where there's a lot of things that could be easily diagnosed very quickly, or at least expedite the evaluation of where something should be on a clinical side. I think there's a lot of work that is thrown on the providers where they have to do things that are paperwork and other tedious tasks, and then also try and treat members, see patients, see this. So I think the AI component can be where a medical provider can just focus on delivering care and let the AI listen to that meeting, take notes on what exactly there, listen to the diagnosis, have that be so that is covering their butt when it comes to their medical bills. Because sometimes that's what these insurance carriers can bank on. Oh, where's the medical records? Where's, the documentation of why you provided this? And so I think having that component is crucial. Where I think also AI could be, bad is just eliminating jobs that still need a human component. And again, I think that AI is a great tool if it's used appropriately. I think there is things that we probably felt AI would be at right now that it's just not there. But a lot of people are, no, it's there. It's there. And it's like, no, it's not.
Yeah,
It's not there.
exactly.
And so
Yeah.
it's scary to see because I think there could be a lot of jobs that might get eliminated. A lot of careers people are investing time and energy into on a college degree that I think might be obsolete very quickly. And that's where I think it's great to see individuals, do more of a trade school, approach. I mean, maybe you weren't a great student, whatever it is, doesn't mean you're dumb. Maybe you were just wanted a challenge. You wanted to go, be an engineer or go be a plumber or whatever that job may be. And I think that's where I think AI might shift us to being a little bit more hands-on in life on certain things so that we're not threatened by a machine.
Mm, couldn't agree more with you. Are you a pessimist, realist, or optimist by nature?
Probably an optimist. I definitely think anything can be accomplished if you have the right team or the right approach or the right mentality. Of course, I love facts and I love, utilizing what the data is, but doesn't mean that data can be tweaked or modified if you put the right effort forth.
Nice. Well, you're getting pretty popular here in the public relations department. I've seen there's some articles coming out with you, and it's pretty profound things you're talking about here
Yeah.
in the media. How is that affecting your business? Public relations and being seen and heard.
Yeah.
The changes you're making in the marketplace.
Yeah. Well, I have a great PR team. They probably put me in situations and things that I'm really not used to being in. And it's great. It's, something that I'm very passionate, proud, and love what I do. So it's great getting out there. I think my clients, of course, our industry is very large, but it's very small when it comes to the business side of healthcare. And so every time I'm at a conference or traveling somewhere, they're like, oh man, like you're like a celebrity now. And I was like, oh, I don't think so. But yeah, I mean, cool if you think so. And I've gone out of my comfort zone a lot. I love the press we're doing. I love putting it out there. I think our clients are also liking it as well. I want to be able soon, I think, now that we have the business we're bringing in and we're really laser focused on expanding that relationship. And that's where, again, I'm kind of, again, might be a little crazy and maybe people think it's like a sales tactic, but for all the business we're bringing in like about 3 to 4 months, I might close the books for about 6 months or 9 months. And so I want, once I have those relationships, be able to even promote maybe their services on that platform I have now and not just make it all about me or about my company. And I'm always trying to, promote my company. I don't want to make this about myself. I love my team. 80% of my staff have worked for me at all 3 of the networks, or at least 2 to 3 networks. So I think that shows a good track record of being a leader, that people will follow me and we know that we're doing it the right way. And so being ways just to, again, maybe if it's a collaboration or if I'm just saying, hey, I'm going to, put the money forth and go on this TV interview or pay for this article and I want to feature you on it as well.
Oh, nice. You gonna write a book?
Probably. I mean,
Title gonna be?
the grass ain't always greener on the other side. No, I don't know. I think I would probably want my business partner, Charlie Hildebrand, who has been a real mentor to me. Charlie's had 2 9-figure exits in this industry already. I was working for him before I launched this network. Charlie really didn't have to work again. And I convinced him after he sold his company and luckily exited from the company because, when he sold it, there was a contract. And then once he got out of that contract, I said, hey, man, you got one more run in you, and I think he was just willing to say, hey, I'll help you out. Let's see. But, I'm probably not going to be much of value. And now he can't leave. He's in it. He's like, this is so much fun. I love what we're doing. I see what we're changing. And just the things I've learned from Charlie, I would like him to maybe write a book, or we do it together. Or maybe I just take his stories and run with them as mine. No,
I'm sure your insights into that could help a lot of people on all sides of the spectrum you serve here, from
yeah,
your clients, the providers of health insurance. This stuff is really not talked about enough, and it's one of the most important things. Our health is our wealth. It's so important. So, awesome.
I think people try to, not in our position, but just in healthcare, really try to overcomplicate it on purpose so that they feel like they're the smartest person in the room when they're selling you this high premium increase. And it's, to be honest with you, again, I've been doing this forever, but you could really simplify and dumb down healthcare if you really just were caring about the consumer and providing something more simpler to utilize and use. But when you want to throw this, and we need this, and you need to pay $3 more for this and 5% more for that, it's just like, what are your real interests are? Is this to benefit their pockets or actually save the client money or better quality of care?
Are you guys considering lobbying for anything, any changes in the landscape?
I've recently just got connected with some pretty important lobbyists that are on Capitol Hill a lot and play on both sides of the aisle. They're definitely encouraging me to do it. I was just in DC a couple weeks ago. This last week I was in New Orleans at an event with the governor of Louisiana and the soon-to-be governor of South Carolina, trying to work with them on some things that can be implemented in the state, and might be doing some stuff with the historical Black college universities and the SWAC conference of student athletes. So, yeah, I mean, we're ready to help everybody. It's just, can people break from their norm, And sometimes, again, you have people that just, they can't get over, I need that United logo on my card, and I'm like, okay, let us know when you're ready for real change.
Right. All right, Jared. Well, some fast, rapid fire questions for you. High quality care or low cost care? Or is that a false choice?
Can we have both? No, I would say high quality care in the right specialty, low cost in specialties that I think aren't as catastrophic claims issues.
Let me ask you something outside of this. Do you need insurance or do you not? I guess I didn't even cover that yet.
Is this recording right now? No.
Yeah, I mean, let's say you're under 40, let's say 20 to 40, and you're healthy. Do you need insurance or do you not?
No kids? No wife?
No wife.
I could say that you could roll the dice a little bit, or you could pay for cash pay to a provider, or you could sign up for like a shared ministry program. So, Christian Healthcare Ministries is a great, I think, solution that covers the costs, covers your healthcare and what you need at a much lower premium. But I mean, I could say that depending on how healthy you are and how much pockets you have, you could probably live without health insurance.
Right, because you have your premium and then you have the deductible. So you're not really saving that much.
Think if are you really spending $15,000 on your healthcare needs every year? And probably not.
No.
For most 40-year-old men.
Right. Okay. All right. Very good. One word for the current U.S. healthcare system.
Broken.
PPO or RBP?
PPO all day long.
Why?
Because RBP is going to cause you noise. It's going to cause member issues. It's going to keep frustrating the provider community. And our PPO is going to give you the same level of savings with a real legitimate discount and contract. That's going to bring no noise, no issues, and never
deny you access at the medical provider.
But if you are not in an employer network, you do not serve that community as of now.
Not as of now. We have goals of being potentially a health plan in certain markets. In certain markets like Arizona or Wisconsin or Colorado, we have a really strong network where literally overnight we could be a health plan.
You
for
can
one.
cut out the middleman, essentially. You already have the deals
Yeah.
network.
I already own the paper. I mean,
Dude, that's strong.
I mean, and again, I ponder that idea all the time, and I just don't.
Dangerous.
Yeah, I mean, I want to make sure we finish some kind of goals we have, but trust me, it's definitely in the back of my head every day.
Okay, good. I love to hear that for all of us. It's amazing. What's the best advice you've ever received on leadership?
I've worked for some very unique individuals, I guess you could say. Some a little bit more hardcore than others in certain ways. I would say that maybe never assign a task that you're not willing to do yourself. So, and that's kind of my own, I guess, advice I've given myself, because I've started in this industry so young at 17, and I've worked in the data entry, I've worked in the customer service, I've been in the medical billing side, I've done managed care contract, I've sold health plans, I've done every single task when it comes to the PPO world. And that's why now I love it, because I can relate to every single one of my employees, and I'm never belittling their task, and I want them to love their job and give them as much support as possible to be the best at their job they can be.
So be willing to just do whatever it takes.
Whatever it takes.
Whatever you're bossing somebody around to do, you're willing to do yourself.
Yep.
Amazing. What's the biggest myth about health insurance?
That it brings you value. That you need that logo on that card to feel comfortable or warm and fuzzy inside to get access.
What's a piece of advice you would give to young entrepreneurs right now that are maybe just getting started, or they're struggling to get up that hill?
Understand your solution, understand where it fits in the market, and understand how you can scale fast. Unless you have a serious investment company backing you, but still, again, they want returns, how do you scale fast and differentiate your solution from what's existing out there?
Best advice. That's amazing. I love that. One book every founder should read.
Traction is a good one. The Art of War is also a good one. And I'm a sports guy, so anything written by Phil Jackson, I kind of like, and doesn't align with everybody's philosophy, but I love his books. And then, God, I'm drawing a blank on the name. The coach of UCLA's he's passed away now since, but his books are pretty well good as too. But I know I answered more than I should on that. Hope you like reading. I give you some good.
Yeah, exactly. Traction that's the EOS system, right? Yeah, I've read that book.
Yeah.
It's phenomenal. Your vision and your team, and
Yeah,
it is amazing.
It is.
Great piece of literature.
and they got the audio book too if you're busy and can't read.
Yeah. Are you part of EOS?
Too busy right now.
You don't need it.
Yeah.
Okay. Scale fast or scale right?
Fast with a sprinkle of right, because again, you need some early wins to get the plane in the air, and once it's in the air, you can modify and add to the wing and throw something in the engine. But I would say you got to scale fast. Unless you're just willing to burn your investment you have, or have an unlimited amount of cash to go through, I would say you have to still scale right, and you can adjust on the fly. Because if you're scaling fast, you must be doing something right for your consumer, and then you can always modify and make tweaks to that product to then make it back on that right direction if you need to.
So strategy or execution? Because one of the problems I have is I get in strategy hell, and I'm sure you've been there. Strategy or execution? What's more powerful?
I think, again, I would say execution, because strategy can always adjust and change depending on the clients you're selling to. I am a very analytical person. I love to bring in people that I trust that are smarter than me in certain aspects. At the end of the day, my team would say I'm kind of the visionary of this, but I don't like to just be, my way or the highway. But I think that you really do have to execute fast and can adjust on the fly.
Awesome. So what's your go-to way to decompress?
I would say golf, family time with, with the kids and hanging out and, trying to, be at their level and what they want to do, entertain their imagination so it can get me out of the world of what I'm thinking at. And definitely, if I already didn't say golf again.
How many hours a week are you getting your own leisure time versus, work,
Um,
busy?
lately, I would say maybe 1 hour max,
Wow.
I would say, I mean, maybe when, he's asleep and I'm not trying to work late at night and, I can watch something on the phone or whatever it is. There's not as much good television on right now. A lot of the shows are already kind of, I finished up those seasons. So, yeah, I'm constantly on LinkedIn and looking at what my competitors are doing. That's my entertainment. You guys going on LinkedIn and looking at my competitors but
That's a good tip. Thank
yeah.
you. I need to do more of that.
Yeah, I mean,
Smart.
I mean, again, I'm not on Instagram as much. Again, I put content out there, and the company has its PR. The company has its Instagram. I let the PR team really advise me and put stuff together. But I live on LinkedIn. I live on LinkedIn.
Yeah.
That's my Facebook or Instagram, I guess you could say.
That's why it's good you have a good PR team.
Yeah, let them do the work. I can't do that. They're too good. I wouldn't even try.
This is a big question. What's your biggest business risk that paid off?
I was before I joined Charlie's company, and the medical billing company, I was offered 33% equity of an existing company now that still exists today, and I love the people that work there. I knew that it would probably never let me build again what I was going to do, and being that I've been an owner of another network where I didn't have over 50% and it didn't work out the best for me, I gambled on myself again, taking a job with no equity, stock options I didn't hit, but I was willing to try something new, and it was still going to keep me relevant to where I would gain the knowledge I needed to then transition Unity and build Unity. So I think it was then launching Unity because I had reference-based pricing companies that are making millions and millions of dollars off no discount, and people are thinking it's the greatest thing since sliced bread. And taking that risk of quitting my nice cushy job that was $1 billion company and could have walked away with my nice salary and my PTO and done all that to say, hey, I'm going to start something and with no paycheck and I'm going to change the industry.
Wow.
And that was probably by far my biggest risk after, again, kind of being, I don't want to say, being that I've had some ups and downs, you could say, with some of the other businesses I've had.
And to segue in that, what's the hardest part of disrupting this entrenched industry?
Getting people to change for the better of their clients and getting them to realize they need to change and implement us, even though they might not be getting that shared revenue that they're getting from our competitor. Mm-hmm. So a lot of our clients, again, they have a hard job as it is managing the plan, but there's a lot of incentives that they get from some of our other competitors. And that might be, hey, I'm going to be the biggest sponsor of your events, or I'm going to make sure you guys go golfing all the time. And so, we just want to do our job the right way, generate savings, ultimately allow these people to make sure come renewal time, they're not losing any business and they're still being profitable. So trying to get them to change from some of the nice little friendly partnerships they were
gifting.
Yeah.
Still goes on. It's not supposed to, but
of course not.
It does all the time.
Yeah.
Awesome.
Just branded differently.
My last question for you is, what's your personal superpower?
I literally, regardless if I sleep 5 hours or 2 hours, I beat my alarm clock and I jump out of bed running. So sleep has been something that I've never really relied upon. I'm a morning person, regardless of whatever part of the world I'm in. So I think it's no matter what, I have extremely high energy. I mean, I sometimes feel like I'm, I know I don't look it or I know I don't act it, but sometimes in my 20s, the way I wake up and hit the ground running, I guess you could say.
Well, you have a deep passion for your life and
Yeah.
your career and your family and serving others.
Yep.
And I feel like that might fuel you and keep you going all the time, even when you're tired.
Yeah.
I can see that in you, man. This is an incredible opportunity to get to know you better, what you're doing for others.
Yeah.
Just an amazing interview. I hope people look back on this and they see what you're doing, because I think you're going to do even bigger things
Yep.
the next 10 years.
Thank you.
I hope some of your good ideas hit policy and actually change healthcare. I think
Yeah.
that, from this conversation, it sounds like you are the guy that could do this. It's a big hill to climb. Good.
Italy.
I hope you have your oxygen tank when you get at 30,000 feet.
I
right?
agree. I just hope this energy doesn't burn out. And like I said, the one good thing is another superpower, I guess, is that, like I said earlier, I love what I do.
Yeah.
And I don't consider this a job.
Well, thank you.
Thank you.
I want to thank Jared for coming on this episode and explaining the conundrum in healthcare and how he's helping to solve it. Jared, let the audience know where they can reach you at.
Yeah, so you can visit our website at Unity Preferred Network. We also have our Instagram page, Unity Preferred. We, of course, encourage you, if you're a large employer, small employer, talk to your broker. Ask them what the TPA is that is underwriting your benefits and policies, and we'd love to gain your business and see how we can expand the network customized based on your needs.
Thanks for joining us. Always be your best self. We'll see you next episode. Peace.